Which position is recommended after spinal anesthesia to prevent headache? Supine, Fowler's, side lying, prone. Correct answer is option A, supine. Which vein is commonly used for IV cannulation in emergency? Cephalic vein, basilic vein, median cubital vein, saphenous vein. Correct answer is option C, median cubital vein. Which diagnostic test confirms pregnancy earliest? Ultrasonography, serum beta HCG, urine test, abdominal palpation. Correct answer is option B, serum beta HCG. Which is the commonest site for intradermal injection? Abdomen, upper chest, forearm, buttock. Correct answer is option C, forearm. Which bone is most commonly fractured in elderly due to osteoporosis? Humerus, radius, tibia, femoral neck. Correct answer is option D, femoral neck. Which blood test is most specific for myocardial infarction? Troponin, CKMB, LDH, none of these. Correct answer is option A, troponin. Which type of insulin is rapid acting? NPH, regular insulin, less pro, none of these. Correct answer is option C, less pro. Which condition is known as honeycomb lung on X-ray? Pulmonary embolism, interstitial lung disease, asthma, bronchitis. Correct answer is option B, interstitial lung disease. Which diagnostic test is used to confirm HIV infection? Western blot, ELISA, VDRL, Widal test. Correct answer is option A, Western blot. Which drug is used in the treatment of organ rejection after kidney transplant? Methotrexate, azithromycin, vancomycin, cyclosporine. Correct answer is option D, cyclosporine. Which condition is also called breakbone fever? Malaria, dengue fever, yellow fever, typhoid fever. Correct answer is option B, dengue fever. Which is the universal antidote in poisoning emergencies? Activated charcoal, sodium bicarbonate, atropine, magnesium sulfate. Correct answer is option A, activated charcoal. Which lung sound is typical of asthma? Crackles, wheezing, stridor, pleural rub. Correct answer is option B, wheezing. Which is the most common site of peptic ulcer? Stomach body, esophagus, cardia of stomach, duodenum. Correct answer is option D, duodenum. Which organ is most commonly enlarged in malaria? Spleen, kidney, liver, pancreas. Correct answer is option A, spleen. Which is the first permanent tooth to erupt in children? First premolar, central incisor, first molar, canine. Correct answer is option C, first molar. Which drug is contraindicated in asthma patients? Beta blockers, corticosteroids, latrokin antagonists, theophylline. Correct answer is option A, beta blockers. Which is the most common cause of meningitis in newborns? E. coli, Staphylococcus aureus, Streptococcus pneumoniae, Group B Streptococcus. Correct answer is option D, Group B Streptococcus. Which is the first line drug for tuberculosis treatment? Ciprofloxacin, isoniazid, azithromycin, none of the above. Correct answer is option B, isoniazid. Which condition is characterized by mask-like face and tremors? Parkinson's disease, Alzheimer's disease, multiple sclerosis, stroke. Correct answer is option A, Parkinson's disease. Which cardiac arrhythmia is most common in hyperthyroidism? Ventricular fibrillation, atrial fibrillation, bradycardia, junctional rhythm. Correct answer is option B, atrial fibrillation. Which route is used for administration of BCG vaccine? Subcutaneous, intramuscular, intradermal, oral. Correct answer is option C, intradermal. Which type of shock occurs due to severe allergic reaction? Cardiogenic shock, septic shock, hypovolemic shock, anaphylactic shock. Correct answer is option D, anaphylactic shock. The normal range of intracranial pressure is 2 to 5, 5 to 15, 20 to 30, 30 to 40. Correct answer is option B, 5 to 15 mmHg. Which electrolyte imbalance is most commonly associated with cardiac arrest? Hyperkalemia, hypokalemia, hypocalcemia, hypernatremia. Correct answer is option A, hyperkalemia. Which is the most common cause of postpartum hemorrhage? Uterine inversion, retained placenta, uterine atony, vaginal tear. Correct answer is option C, uterine atony. Which electrolyte imbalance is common in chronic renal failure? Hyperkalemia, hypokalemia, hypernatremia, hypocalcemia. Correct answer is option A, hyperkalemia. Which investigation is used for screening of breast cancer? MRI, CT scan, mammography, ultrasound. Correct answer is option C, mammography. Which position is best for a patient with left-sided pleural effusion during thoracosynthesis? Supine, Fowler's position, Trendelenburg, sitting leaning forward. Correct answer is option D, sitting leaning forward. Which vaccine is given to prevent cervical cancer? Hepatitis B vaccine, HPV vaccine, polio vaccine, rubella vaccine. Correct answer is option B, HPV vaccine. Which condition is also called lockjaw? Tetanus, rabies, meningitis, polio. Correct answer is option A, tetanus. Which stage of labor is characterized by complete cervical dilation to delivery of the baby? First stage, third stage, fourth stage, second stage. Correct answer is option D, second stage. Which vaccine is given orally in the National Immunization Schedule? BCG, DPT, polio, measles. Correct answer is option C, polio. Which is the safest oxygen delivery device for cough patients? Non-rebreather mask, Venturi mask, simple pace mask, nasal prongs. Correct answer is option B, Venturi mask. Which drug is contraindicated in pregnancy? Tetracycline, penicillin, cephalosporin, erythromycin. Correct answer is option A, tetracycline. Which cranial nerve is responsible for the sense of smell? Optic nerve, olfactory nerve, trigeminal nerve, glossopharyngeal nerve. Correct answer is option B, olfactory nerve. Which diagnostic test is used for cervical cancer screening? Pap-smear, colposcopy, ultrasound, MRI. Correct answer is option A, Pap-smear. Which condition is characterized by moon pace and buffalo hump? Hypothyroidism, Addison's disease, Cushing's syndrome, acromegaly. Correct answer is option C, Cushing's syndrome. Which is the drug of choice for eclampsia? Diazepam, phenytoin, phenobarbital, magnesium sulfate. Correct answer is option D, magnesium sulfate. Which is the first aid management of epistaxis? Nosebleed. Tilting head forward and pinching nose, tilting head backward, a flying heat over nose bridge, immediate nasal faking only. Correct answer is option A, tilting head backward, forward and pinching nose. Which fluid is preferred in hypovolemic shock? Dextrose 5%, normal saline, Ringer's lactate, albumin. Correct answer is option C, Ringer's lactate. Which is the most common cause of peptic ulcer disease? Stress, H. pylori infection, spicy food, and NSAID use. Correct answer is option B, H. pylori infection. Which hormone is secreted by the adrenal medulla? Cortisol, aldosterone, epinephrine, ACTH. Correct answer is option C, epinephrine. Which heart sound corresponds to closure of the mitral and tricuspid valves? S1, S2, S3, S4. Correct answer is option A, S1. Which heart sound corresponds to closure of the aortic and pulmonary valves? S1, S2, S3, S4. Correct answer is option B, S2. Which is the first step in basic life support BLS? Airway, breathing, circulation, checking responsiveness. Correct answer is option D, checking responsiveness. Thanks for watching. Subscribe to the channel for the latest informative MCQs.